Are you living with chronic pain and wondering if vitamin D is something that might be helpful? Have you even tried supplementing and not found any benefit from it? If so, you're in the right place because in this video, I'm going to break down all the mechanisms by which vitamin D helps lay the foundation to make all other chronic pain treatments better. And I'm also going to go over the lab values that you want to strive for, as well as how to get more vitamin D. And by the end, you're just going to be one step closer to treating your chronic pain yourself. Vitamin D is not just for your bones, it is for your pain. And if you're suffering from chronic pain, you need to know that vitamin D directly and indirectly influences pain signaling throughout your body. The first mechanism is through your TRPV1 receptor, which is a receptor we actually talked about last week in regards to analgesic creams, especially those containing capsaicin, the warming creams. The thing is, when those creams wear off, this receptor stops getting modulated and it increases pain and inflammation. But keeping your vitamin D levels optimal can modulate this receptor for longer periods of time, decreasing the amount of pro inflammatory cytokines while keeping around those anti inflammatory cytokines. Then vitamin D helps increase GABAergic interneurons. Really important. Last week we talked about the gate control theory of pain, and a few weeks before that we talked about pain centralization, where too much pain signal is making its way through your spinal cord into your brain. So you're experiencing pain disproportional to the stimulus. This helps increase those amount of inhibitory interneurons, which increases descending inhibition, which prevents too much pain signal from making its way up your spinal cord to your brain. Really important. Now, vitamin D also affects your dorsal root ganglions, which is the junction between the peripheral nerves and your spinal cord. So once again, you're not pushing too much pain signal through to your brain. And vitamin D directly and indirectly affects your DNA as well. Studies have shown that there are 23 genes involved in opioid signaling that vitamin D has its little paws on. So if you're taking opioids, vitamin D can help those be a lot more effective and reduce your risk of dependency on them. Uh, Vitamin D affects 14 genes associated with nociception, so that's just general pain signaling, and also 8 genes associated with allodynia, which is a chronic pain condition where just almost any stimulus causes excruciating pain. So vitamin D, not the cure-all, but it is the single most important nutrient in your body. It's actually a hormone. This is the basis. We have to get this right. And then all of your other treatments, whether you choose to go a conventional route or a more holistic route, will just be more effective because your vitamin D levels are optimal. Most chronic pain patients are actually deficient in a really simple nutrient that ends up affecting their inflammation. And we're not talking about acute inflammation, the swelling associated with an injury. We're talking about chronic inflammation, that low grade systemic inflammation that is just wreaking havoc behind the scenes and is not detectable on most basic labs or images. So now, of course, we're talking about how vitamin D affects chronic inflammation, and it does so through 6 prominent mechanisms. The first is keeping cytokines in check, so allowing more anti-inflammatory cytokines while decreasing the amount of pro-inflammatory cytokines in your body. Also, tumor necrosis factor alpha, which is very prominent in the chronic pain community, helps keep that in check. Then my favorite, the nuclear factor kappa beta pathway. It's a chronic inflammatory pathway which we actually don't have really any medications that touch that pathway. This is more regularly modulated through nutritional and lifestyle factors like having optimal vitamin D levels. Then there's the nitric oxide, which a couple of weeks ago we talked about blood flow and that's importance with chronic pain. And if you remember, I was talking about how nitric oxide is so wonderful. It's a vasodilator, so you're getting more blood and therefore oxygen and nutrients to those damaged healing tissues. However, with most things in the human body, We have to find that right balance because not enough nitric oxide is a problem, but too much can also cause too much inflammation as well. Vitamin D keeps those levels right in check. Then there's the COX-2 pathway. This is the pathway that's actually inhibited through NSAIDs like Aleve and ibuprofen. But now you're getting all the benefit without the risks of those NSAIDs. Vitamin D also keeps your gut microbiome in check, decreasing the amount of firmicutes, which are those bad bacteria, the ones that cause inflammation, poor neurotransmitter synthesis, things like that, and promote bacteroides, which creates an anti-inflammatory environment and one where you can create neurotransmitters and absorb nutrients better and help fight inflammation. So, vitamin D, it sounds like it's this miracle thing, and it kind of is. It's the most important nutrient in your body, but it's not just going to fix your chronic pain. We talk about this because this is the basis. You have to get these things right. An optimal vitamin D level is just one of those things that's now going to make all the rest of your treatments a lot more successful. It's likely that your chronic pain began with an injury, but at this point, it's actually pretty unlikely that that pain is being continued by damage in unhealed tissues. In reality, most chronic pain conditions are actually perpetuated by poor pain signaling in the central nervous system due to neuroinflammation. So, this is where vitamin D helps. First, it regulates microglial and astrocyte cells. These are specialized cells in your brain that keep a nice, clean environment. Their job is to remove waste and inflammation. But if they're not doing their job right because vitamin D is too low, that inflammation just builds. And this contributes to things like that gate control theory of pain we talked about last week, pain centralization we talked about a few weeks before, and we'll continue to talk about because it's that important for chronic pain. Vitamin D also increases those GABAergic interneurons, which play a major factor in pain centralization, keeping too much pain signal from reaching your brain. Vitamin D also increases endogenous opioids, the opioids your brain naturally makes. If you're not making those, you're just naturally going to experience pain more than you should. So now vitamin D seems like it's a pretty miracle hormone, doesn't it? It is. It's the single most influential hormone in your entire body, but it's not a cure-all. It is just laying the foundation so that everything else we do, either from a conventional or natural standpoint, is just going to be more effective now. If you're experiencing tight, achy, weak muscles with your chronic pain, it might not be because those muscles are overused or just weak. It might be because of a nutritional deficiency, especially vitamin D. Vitamin D is so important for muscle function recovery because it promotes cell differentiation. This is the process of taking a newly synthesized immature muscle fiber and creating a nice mature muscle fiber that's going to do its job a whole lot better. Vitamin D also stimulates your mitochondria to make more ATP, more energy to actually use your muscles, but more energy to relax muscles as well. It actually takes more energy to relax a muscle than it does to contract one. Feed your mitochondria. Vitamin D increases protein synthesis, so all the food you're eating helps convert it into proteins that your muscles can build on. Decreases oxidative stress. So you've heard of free radicals. This is why we take antioxidants. Vitamin D reduces that oxidative stress so that your muscle fibers can be in a state of growth more than damage. Helps with calcium flux. So you need calcium to start a muscle contraction, but calcium can also cause a lot of pain. So we want that modulated. We don't want too little, we don't want too much. Vitamin D keeps it right in the sweet spot. Vitamin D also, as we've been talking about, anti-inflammatory. Let's put your muscles back into a state of growth instead of just fighting off damage all the time. Vitamin D seems like it's a miracle cure. Keep in mind, this is just laying the foundation. Once we get that right, then all of your other treatments, whether conventional or more natural, are going to be more effective for treating your chronic pain. You should never be prescribed opioids for your chronic pain until you've had your vitamin D levels checked. And that is because vitamin D is necessary for the synthesis and recycling of dopamine, your feel good, your reward neurotransmitter, what's necessary for pleasure, motivation, memory, motor control, all areas of the brain that are affected by chronic pain. In fact, a dopamine deficiency can lead to central sensitization, which is that phenomenon where too much pain signal makes its way through your spinal cord into your brain, and now you feel pain disproportionately. But dopamine also makes opioid medications more effective while reducing the reward properties, so you're less likely to get addicted to them. Vitamin D, not a cure-all, but an absolute necessity to get right for chronic pain. It's just going to make all your other treatments that much more effective. If you're living with chronic pain, then you're probably asking how much vitamin D should you be getting and where from? Well, the very first thing I want you to do is to look at your labs. You see that reference range? Just forget it. We don't care about it. Reference ranges exist to prevent disease. We are trying to promote function. So the functional range should be 50 to 100 of 25 vitamin D. Your doctor ordered the 125 vitamin D test, politely ask them to order this one. The difference does matter. Now you have to understand, where do vitamin D deficiencies come from? Well, first, we make vitamin D from the sun. We take its UV rays, mix it with a little cholesterol, and create the hormone vitamin D. If you are not getting enough sun, either because of where you live, winter, or you're just not getting outside enough, then you might be in a deficient state and you might want to consider supplementing. Otherwise, if you're taking a statin, which is going to lower your cholesterol, you're lowering your ability to make vitamin D from the sun. And if you're not getting it from the sun, you need to be getting it from animal food sources. So if you're vegan or vegetarian, that can pose a problem as well. So now, if we do want to supplement to get our levels back to this range, you want to look for a liposomal vitamin D with K2 supplements. Unless you're on a blood thinner, then don't get the K2, just get the D3. And this is important for a couple of reasons. One, vitamin D is a fat-soluble vitamin. Liposomal means it's suspended in fat, therefore you're just going to absorb a lot more of it. But with vitamin D comes the increased absorption of calcium, which is a good thing, except for that calcium is now just floating around your bloodstream, where it can cause plaquing and atherosclerosis, decreasing blood flow, which we talked about a couple weeks ago, in its own right can contribute to many chronic pain conditions. So the vitamin K is what pulls that calcium out of the bloodstream and puts it into your bones to create a much safer environment. So there you have it. Now you know exactly why vitamin D is so important for all chronic pain conditions, what levels you should be striving for, and how to get more yourself. Now you're just one step closer to treating yourself.